Hello students, welcome to Distinction Learning Platform, and on this platform you'll find revisions, questions, quizzes, expansion to difficult topics, a lot of stuff. So before we begin our lessons, make sure that you subscribe so that you can be updated with all upcoming videos. To make the story short, let us begin. So in this video, we're talking about osteomyelitis, okay, which is under what? Surgery. Remember that surgery has two parts, which is there is general surgery and what? Orthopedic what? Surgery. So, but osteomyelitis is studied under what? Orthopedic surgery. Okay. Now, what is osteomyelitis? Okay. Osteomyelitis basically starts the inflammation or infection of the bone and what? Bone marrow. So, what is the simplest definition of osteomyelitis? We're saying it is what? Infection or inflammation, okay, of the what? Bone and bone marrow. That is basically what? Osteomyelitis. Osteo means what? Bone, which is this. Osteo means bone. Myelo means what? Marrow. And litis means basically that is what? An inflammatory or inflammation. Okay, now the question that you can ask yourself is that why studying osteomyelitis? Why is it important to study about osteomyelitis? Because there's an important reason why it is really important to our case. Because if you talk about the treatment of osteomyelitis, it is very difficult to treat osteomyelitis. In fact, when it reaches the state of what? Chronic. Okay, the chronic state of what? Osteomyelitis is going to be difficult to what? Treat. The reason why it's difficult to treat it is because of what? Ineffective penetration of what? Antibiotics to the site of what? Infection, why the infection is in the bone. Okay, very important point to understand. And this, because it's really difficult to what? To treat it, the infection now, it can lead to different complications that we'll talk about. Like in children, there'll be what? Growth arrest, there'll be sepsis, there will be what? Bacteremia, there will be acute renal failure, a lot of what? Complication that can arise because of what? This bone infection. So you need to understand it. Now, the other thing that you need to understand about osteomyelitis is what? You need to understand the population that it can affect, okay? Because that is the most important case, important point that you need to take note. So why is it what? Common? The first one is what? It is common in what? Children. So let us write that. So it is common where? It is common. So osteomyelitis is common. So let's say CM, common in where? We're saying children. Okay. Okay, it is common in children. We talk about an outcome. Why it is common in children. Okay. It is common in children. It is also common in what? Elderly. Okay. It is common in what? Elderly. What else? Diabetic patient. So let's say DMPT, diabetic what? Patient, okay? And the most important part is the adult can be affected most of the time if they are what? Immunocompromised. So it is also common in what? Immunocompromised patient. So let's say immunocompromised. Immunocompromised patient is common as well in such what? Cases. Okay, so since now we've understood where the osteomyelitis is common. It's common in children, common in elderly, diabetic patient, and what? Immunocompromised what? Patient. Okay, now the question is, since it is an infection of the bone and the bone marrow, what are the causative agents that can cause that? What are those infectious agents that can cause osteomyelitis? Do you know that? Which one is the common? The common one is what? Staphylococcus aureus. Okay, that is what? Staphylococcus aureus. Staph aureus. So, which is the common what? Let's again talk about the common agent. The common agent that can cause what? Common agent that can cause osteomyelitis. We are saying what? Staph aureus. Very important word. Agent. Staph aureus, and it affects about what? 60 to 90% of what? Cases. Very important to take note of that. Okay, 60 to 90% of cases, you are going to find that the microorganism that's going to affect a patient with osteomyelitis is what? Staphylococcus aureus. You need to take note of that. But there are also some special cases. Okay, like someone having H influenza, okay? So H influenza, this one, H influenza or Haemophilus influenza, this influenza is going to affect about what? The 20% of cases, of all cases that are with osteomyelitis, they are going to be what? Affected by H influenza in what age group? Less than 4 years. So I'm saying about 20% of cases. So here we said 60%. So let us write that one so that we don't forget. So here on Staphylococcus aureus, we are saying 60 to 90% of all cases to be caused by what? Staphylococcus aureus. Okay. The H influenza is like in about 20% of cases. So 20% of cases in what? Should be less than what? 4 years. Okay. That is also an important what case to take note of that. Okay. There is another one. Then if you talk about the Streptococcus pyogen, strep pyogen. So let's say strep pyogen, another important case, strep pyogen. Okay. Strep pyogen is going to affect children greater than what? 1 year. Greater than what? 1 year. Greater than 1 year. So you are going to find the strep pyogen affecting people like that. Another important case that you are going to be examining on. What is that? Salmonella. So people with sickle cell disease, they are prone to have what? Salmonella. And salmonella is a causative agent of what? Osteomyelitis. So if you look at someone with a history of what? Sickle cell disease, what do we expect the causative agent? We are saying Salmonella. Okay, Salmonella is a causative agent of what? Salmonella species causative agent for someone having what? Someone having what is the sickle cell what? Disease. Okay, SD. Very important case as well. And last and not the least, which is if you talk about those IV drug abusers, they are at increased risk of having what? Pseudomonas. Okay. So let's Pseudomonas. So what about Pseudomonas? Okay, Pseudomonas aeruginosa, Pseudomonas. Okay. Pseudomonas is really common in what? IV drug what? Abusers. Okay. Very important point to take note. Okay, so that is basically the like introduction to osteomyelitis. These are the important cases that you need to be aware of. Okay, in case someone comes in with what? Osteomyelitis. Now this same disease that we're talking about, how can you classify it? Okay, because classification is important when it comes to what certain cases. So how can you classify this one? Okay, because classification is going to help you to diagnose different cases of what? Osteomyelitis. So we can classify it according to what? The first one is what? Duration. Okay, so we can classify osteomyelitis according to what? Duration. The first one is what? According to duration. That is the first one, according to duration. Okay, so according to duration, we are going to say, remember that now there will be, according to duration, there will be 4 cases, okay? 4 types of what? Osteomyelitis. The first one is what? Acute osteomyelitis, okay? So the first one is what? Acute osteomyelitis, okay? Myelitis. Acute osteomyelitis, okay? And what is the second one? The second one is what? Post-acute. This is now very simple. Post-acute is a second one. Post-acute osteomyelitis. What is the third one? The third one you know. That is now subacute. Subacute osteomyelitis. What is the fourth one? The fourth one now is the chronic one. The one that you are going to be assessed most of the time. Chronic one. Chronic osteomyelitis. Okay, let's just say osteo. Okay, so you've seen there are 4 main cases when it comes to duration. How long does it take? Now the question is, you need to know the duration, because acute is for long, post-acute, subacute, and chronic is for long. Because if you know the duration, if someone comes in with maybe some certain symptoms that are indicating to what? Osteomyelitis, you need to ask when did those symptoms start. if you ask them, basically if they say these symptoms started a week ago, basically it would be what under acute type of what osteomyelitis. So what acute osteomyelitis, what's the duration? The duration is less than what? 2 weeks. So the duration for acute osteomyelitis is what? Less than what? 2 weeks. Okay, basically some texts they talk about different cases, but this is according to what most of the what textbook they say less than what 2 weeks, then it can cause what? Acute osteomyelitis. Okay, then post-acute, although sometimes it is left out, but post-acute is between what? 2 to 3 weeks, but some texts they say 2 to 4 weeks, but this has considered 2 to what? 3 weeks. Okay, so post-acute, it's just the transition state. So 2 to what? 3 weeks. That is what? Post what? Acute. Then what about subacute? Subacute it will be what? Now between 3 to what? 6 weeks. Okay, now chronic cases now should be greater than what? It has to be greater than now 6 weeks. Okay, greater than what? 6 weeks. Okay, greater than 6 weeks. Okay, that is what? Chronic type of what? Osteomyelitis. Very important point. Now the other important thing is, apart from the duration, you need to know the symptoms of acute osteomyelitis and also the signs of acute osteomyelitis, because it's going to help you to differentiate from any other symptoms. But we'll talk about here, because if you talk about acute osteomyelitis, the symptoms like the systemic symptoms like fever, and other symptoms, they are going to be what? Elevated. If you talk about the systemic effect under chronic, they are going to be what? Decreased. Maybe someone is not going to have fever, positive or negative for fever. So we'll talk about that here. If we understand the pathophysiology, we understand, okay, this happens under what? Chronic. This happens under acute, subacute, or post-acute. If you know such cases or that mechanism, basically you are able to differentiate, okay, this is the state of what? This case or class. Okay, very important to take note of that. Okay, then what else apart from the duration? The duration, now we have another classification, very important one, because we are going to be asked on this. So this classification is called what? Cian-Meder classification, because this one now is going to classify according to the anatomy and according to the physiological state of what? The patient. Okay, so what are we saying? So we are saying, okay, classification according to what? Anatomy. We are saying this classification is under what we call Cian-Meder. Okay, Cian-Meder classification. Cian-Meder classification is with the first class talking about the anatomic what? Classification. Anatomic what? Classification. Okay, so we'll talk about anatomic classification, then the last one we'll talk about what? Physiological type of what? The classification. So what is the first anatomic classification? The anatomic class for Cian-Meder. Okay, what is the first one? The first one is talking about what? What is the first one? The first one is talking about what we call medullary. Okay, medullary type of what? Osteomyelitis. So basically, medullary type of osteomyelitis is going to be just, the infection will be just what? Within the medullary cavity. Okay, there in the medullary canal or cavity, that's where the infection is going to be confined, and basically it will just affect the cancerous bone of the medullary cavity there. Okay, then it will be classified under medullary type of osteomyelitis under atomic what? Classification. What is the other one apart from medullary? There's also another one. Another one is what we call superficial osteomyelitis. So this one, superficial osteomyelitis, is one affecting the what? So here it's affecting, so we can write it in blue here. So what is it affecting? It's on affecting the cortical bone. It's affecting the what? Cortical bone or only. Okay, here we are saying it's on affecting the what? Medullary cavity. That's what we are saying there. Okay, medullary cavity only, like that. Then there's also another one. Now number 3, another one. What is that? Number 3, there's also another one which we call localized. Okay, localized type of what? Osteomyelitis. So localized one is what? It is affecting now medullary and cortical bone. So it's affecting what? This one is affecting the, let's just say M majorly and what plus what? The cortical, which is C. So medullary and cortical bone, they are going to be what? Affected. But the bone is what? This is the important concept. The bone is what? Stable. Stable how? The bone is stable after you remove. So because if a bone is if the cortical bone is affected and also the medullary canal is affected, the bone, there will be necrosis of the bone. If there's necrosis of the bone, now let's say someone someone is under what treatment, they remove that necrotic what bone, but the moment to remove that necrotic bone, the bone is going to be left what stable. It's not going to undergo fracture. Okay, that's what I mean if I say stable. If you remove the necrotic bone, the bone will be left what stable. That's what I mean here. Okay, we'll talk about that. So now what is the number 4? Number 4 is what? Number 4, this is what we call diffuse or diffuse type of what? Osteomyelitis. That's from the word now. Diffuse now is affecting the the all cortical medullary. So we are saying M plus what? C plus what? Surrounding what? Tissues. Surrounding tissues. So this is what it is affecting. And the bone is what? Unstable. Very important point to take note. So don't miss that one. So the bone being unstable is what? Okay, it's affecting. Remember that if this is a bone like that, inside there is a medullary cavity, and this is what? The cortical bone like that, the periosteum, everything. But there are some tissues that are surrounding what? This bone. So everything is going to be affected under what? The diffuse osteomyelitis. Everything is going to be affected. If everything is affected, then what do you think is going to happen? Then even if you remove the necrotic bone there, the bone is prone to what? Fractures. So basically, if the bone is prone to fractures, the bone is what? Unstable. Make sure you need to take note of that. Okay. So since now we've understood about that, so this is anatomic under Cyan Meda. That is anatomic what class? There's also another class here. Another class here, apart from anatomic, we say that is what? Physiological. Physiological type of what? Class. Okay, physiological type of class. Now there is what we call, so physiological, there is so if you talk about the physiological classification, it refers to the what? The physiological status of the patient or someone who is having what? Osteomyelitis. So if you talk about class A, so physiological is further classified into class A, B, and what? C. Okay? So here we are saying there is what? The first class is what? A. Then on A, the host, so you say host is what? Host is normal. Okay? Everything is normal. Basically, the physiological status of the patient is what? Normal. The patient is not immunocompromised or anything else. Okay? They are just normal like that. That is class A. Then you go to class B. What about class B? Class B, host is what? Immunocompromised. So this one, host is what? Immunocompromised. So host is what? Immunocompromised. Okay? So under host immunocompromised, basically they are having an underlying disease. The host response to infection, it is what? It has been decreased. Maybe someone is having HIV infection like that. Any chronic illness that going to compromise what? The immune system of that patient. Then they are under what? Class B type of what? Osteomyelitis, according to what? The physiological classification. Okay? Very important to take note. But this host immunocompromised is further categorized into what? Into like 3 components. Okay, I'll talk about that very fast. I'll be fast here. So there's what we call BS. Okay, this one immunocompromised. Basically, they are saying B. We are saying immunocompromised systemically. So someone is immunocompromised. What is systemically? That is BS. BL. It means that immunocompromised what? Locally. Then SL. Basically, they are both now. So immunocompromised systemically and what? Locally. Okay, it is further categorized into that B1, B2, and what? B3 like that. Okay, that is further information if you want to know more about that. Okay, now we proceed to C. C is what? So host is what? Host is prohibitive. Okay, so we need to know what it means. That prohibitive, what does it mean? It means like so they say it's better to leave the patient alone than treating that patient. Okay, than treating the patient having what osteomyelitis. That's what it means. Host is what prohibitive. Basically, it means that if you are treating, so treatment is making the patient to become worse than leaving them what alone. Okay, so that's what it means. Host is what prohibitive. So treatment makes the patient worse than what leaving them what alone. So that is it. Now classic. Classic now, physiological type classic is now really bad. Very important to take note of that. Okay, there's also another one. So this physiological type or anatomic part, this cyan matter, basically it is used for what? Adult. So you need to know that cyan matter is used for what? Adult. But what about the other one that can be used in like children, like infants, like that? Which classification can you use? So they use what we call bait cure. So they use this classification. So you need to know it as well. We call it bait. I don't know the way you can pronounce it. Bait cure. Okay. Cure type of classification. This one is really important as well. So it's used in what? Pediatric what patient. So there's also class A. So class A, there's also class B and what C. Okay. Class A, class B and what C. Okay. So class A is talking about what? So class A is talking about what we call Brody's abscess. So you find a patient with what? Brody's what? Abscess. Okay. There's an abscess. So Brody's abscess, we're going to talk about it here under pathophysiology, you understand. But basically, Brody's abscess are abscess that can be found within the what? On the metaphysis region there. So that's why you're going to find what? The Brody's abscess. And one of the classical sign for what? It's an acute type of what? Osteomyelitis. The one that we talked about there. Okay? Whew, it's a lot. Now, you go to class B. What is class B? Class B is talking about the sequestrum presence. Okay? So class B is talking about what? Sequestrum. Okay? Class B is talking about what? Sequestrum plus what? Involucrum. Okay? Involucrum. So we'll talk about what it means if you say sequestrum and the involucrum from there, what the pathophysiology. Don't worry, so hang on there, okay? C, what about C? C is what? Now there is presence of what we call sclerosis, okay? Sclerosis. So presence of sclerosis or sclerotic, basically that will be classified under what types? Under what? The pediatric patient. Very important to take note of. So that is now the classification of what osteomyelitis. Although there is another classification which we say classification according to what etiology. Okay, maybe like there will be TB type of what osteomyelitis, staphylococcus type of osteomyelitis. Those are according to what etiology. But the most important ones are what? These. Okay. What about what? One important what class? One important class, I'll talk about it here, okay? So one important class is according to the what? Route of what administration. So there will be what? There will be hematogenous type of what? Route or hematogenous osteomyelitis. There will be what? Direct inoculation type of what? Osteomyelitis. And the other one is what? The other one is the contiguous focus type of osteomyelitis. We'll talk about that, okay? So another class here. So let me just write it here in case we forget. Okay? Another class. So class according to what? Route. So we're saying another class according to that. We'll come back to this one. Okay? Class, another class according to the route. We're saying, okay, hematogenous osteomyelitis. We're saying direct inoculation, okay, osteomyelitis. What is the other one? The last one is what? Contiguous osteomyelitis, okay, contiguous type of osteomyelitis. So hematogenous, basically the infection causing osteomyelitis is via what? Bloodstream, okay, it is via bloodstream. Maybe someone had maybe the upper respiratory tract infection like what? Pharyngitis. they're having UTI, okay, urinary tract infection, they're having what? Skin infection, okay. That would be basically under what? Hematogenous type of what is spread. So direct inoculation, maybe someone had open fracture, they had open fracture, maybe they had the direct penetrating what trauma like that, okay. They had they had a lot of what? A lot of causes under direct inoculation. Contagious, because it's contagious, it is because of what? The skin infection, okay. There's an infection to the skin, like what? Maybe these are pressure sores, like diabetic ulcers like that, the diabetic foot ulcers like that, okay. Those they can spread and cause what? Type of osteomyelitis. This is under this is a class under what? Route. Very important. That's three important classes.